Did you know your head position can have a negative effect on your health? Absolutely. If you're an upper cervical chiropractor, you really don't need me to convince you the power of upper cervical. There are many mechanisms that can be in play that gives us evidence as to the where, when, and what and how of upper cervical results. Over the past few years, some very interesting studies have come out that are alluding to the fact that head position, or I should say the head being in the wrong position, having a negative effect on the blood flow going into and coming out of the brainstem, as well as affecting in a negative way the cerebral spinal fluid flow. Now we can see how this can have an effect on the brainstem. Well, as a matter of fact, it can have an effect on the brain as a whole. But there's one thing we definitely know is from a clinical standpoint, we know that when we do our work, we are having a powerful and sometimes profound effect on the function of the brainstem. Now the brainstem is the seat of control, or I should say the driver, if you will, of the autonomic nervous system. If you do not have good brainstem health, you're not going to have good autonomic nervous system health. That's just the way it goes. And over the past 3 or 4 years, I have done hundreds of heart rate variability studies, pre and post, upper cervical. And what we have found is that most definitely when we apply upper cervical in the proper manner, given adjustments in the right way, the right time, and doing all the factors that need to be done, we really do have an awesome effect on the function of the nervous system and balancing it out and also turning the power on, if you will. Your eyes. Okay, good. Shoulder drop. Good. You hear that? Perfect. Step straight this way. Okay. Yeah. Follow. Okay, good. I have always been fascinated by the effect upper cervical care has on the brainstem and the brain itself. So many different conditions that we see relate directly to this. It may even be something like simple like vertigo, or it can be something more complex like some kind of autoimmune disorder, migraine headaches, multiple sclerosis. Many different things can be affected when the head's in the wrong position and you have an incorrect blood flow going into or coming out of the brainstem, or you have a blockage of the cerebral spinal fluid flow. These are things that we're going to be discussing in the upper cervical neurology portion of our class in Barcelona. Also, there are many things, if the head's not in the right position, it can cause mechanical problems. It can cause chronic low back pain. It can cause a lot of different things that will be affected from the head not being in the proper position. You have the issues that go with an aberrant functioning autonomic nervous system, but you also have the issues that are related to center of gravity and balance type issues. So we'd like to encourage you to come out and join us, and we are going to go through step by step how to do the adjusting, how to do pattern analysis, to know when to adjust, when not to adjust, to see how effective what you've done has been. We're going to go through x-ray analysis, how to read the films to get the proper listings. We're going to be going through applications of how you put it to work in your office. This is designed as a workshop, so we'll be very intensely working, getting your hands on so that you'll be prepared to put this into practice. If you're already practicing this, I think this will go a long ways to helping you elevate and taking you to the next level in your upper cervical work.